It is the world's first splendid achievement. Please watch it till the last.
Cure hyperesthesia by yourself. January 11, 2019. Hateful Kimito of the dentist. When a tooth touches the cold air and drank cold water, a toothache may be caused. It is a sensitivity of teeth, so-called hyperesthesia. If toothache fits when you lick it clean with warm saliva and you breathe it in and pull saliva, it must be it and is hyperesthesia. The cause has small holes on a tooth, and cold air and saliva invade it there, and this is because it stimulates dental nerve. Hyperesthesia becomes severer and severer, and finally treatment of the teeth is usually necessary. Your eating habits are because you like sweets or do not brush your teeth or still have the factor of the cavity. Here, I offer how to cure hyperesthesia, but it is a folk remedy to the last and is only the popular view. It is the popular view having no grounds scientifically. According to a dentist, it will be rather expected that I delayed your treatment of the tooth. The dentist suggests that you should pull dental nerve, but you do not usually have other choices. As a result, the patient will be made to go to the dentist for a long time, more than 1 month, to give a dentist large amount of treatment costs. However, there should be the person jumping at the popular view if he can reduce the pain, even if the person who wants to save little expenditure does not go to the dentist or it can dissolve. For such a person, there is this disclosure. It's the method to block up the cavity hole. On a tooth, it is kind of the cavity, but must sometimes remove calculus because calculus arrives. Calcium included in saliva deposits, and this is because it becomes the den of various germs. If this calculus blocks up the cavity hole, you are thankful, but you really suffer from composure for a long time and cannot choose at which part you bring it on. Therefore, in substitution for calcium included in saliva, you should use the tooth powder. It is paste-formed tooth powder to use for that tooth brushing. High-quality calcium is fully included in that. You apply the tooth powder to a crab, an affected part, after tooth brushing. You just paint with an undiluted solution. It is only this. Then, only at short time before some stimulation and volatile constituent with xylitol flying, a light toothache and refreshing feel do it. You must paint by all means before sleeping and paint after a meal. The salvia may overflow just after that when you paint badly, but it usually fits immediately if you spit out only pee and saliva. You may wipe off saliva with paper. After that, the refreshing feel fade away and return to the normal state that saliva does not flow. Current hyperesthesia should be settled temporarily when you perform the application. Because a hole was blocked up, it is natural. The period of the application is for around 1 week, much shorter than the treatment period of the dentist. During this time, calcium deposits, and a not crowded hole is occupied. In this, present hyperesthesia is certainly evaded. Congratulations! But the conclusive evidence that a hole was completely blocked up strongly cannot last. Probably you should be restored in several months. I emphasize it again, but your eating habits are because they still have the factor of the cavity. Because the factor that a tooth dissolves in does not disappear, it will be natural. Still, the tooth certainly revives if you perform the method mentioned above again. For hyperesthesia, it may be accompanied by a considerable toothache. In that case, you certainly have money stolen, but it will be good choice of rushing into the dentist in a hurry. However, you do not want to spend money very much and go to the drugstore, not a dentist, if you want to put it temporarily, and should buy an antibiotic, e.g., TERRA Cortril. When you apply this to the gingival around the affected part and stencil it to the skin of the chin right under the cavity, toothache is reduced remarkably in around 30 minutes. Anyway, the antibiotic is a powerful weapon for various germs. Even from a rotation, it is still effective. When the hole of the cavity is big, I suggest that you rush into the dentist. However, it begins to ache, and the hole of the cavity is often small, too. It will be an opportunity trying my popular view. I had the results that cured hyperesthesia by myself, and cold ice cream came to be eaten again. At a point to recover really, it may be the world's first splendid achievement. In addition, it is the best method for a person without the money because it is cheap and can carry it out. To the nation of a poor country, it will become the gospel.
Congratulations.
However, it is a folk remedy, and my opinion is the popular view. Even if an effect is not given, do not be angry. But I will say that the person to believe is saved. I ask you as self-responsibility if you carry it out. The end.
The Seeing and Hearing. Thank you.
昔